unforeseeable circumstances, I am the one who is going to give it. And please, so let's stick together. I'm going to use to share some slides right now. So just a moment. Let's see. Are you seeing something there?
Not yet.
Not yet. Okay, so just maybe it needs patience. Let's see. How about now? I think you should be able to see something. Right?
Yes, now yes, thank you.
Okay, now, yeah. All right.
Can you put it in presentation mode, please?
Yes, I have. Is it in presentation mode now?
Yes, it is.
Okay, good. Okay, so the title of the presentation today is Assessing Community Vulnerability to COVID-19 in Mozambique, a Spatial Outlook. And this work is has been done by myself, Sibusiso, as well as Mohamed Ahid. And the outline is as follows. So I'll first give an introduction, part of which I think you already started, the moderator already started giving out. And then we'll talk about the methodology, the findings, the conclusions, as well as what we think might be the implications for policy. So as we are all aware, obviously, we have a pandemic before ourselves. And as a result of this pandemic, now countries are thinking about how do we need to mitigate against the impacts of any future pandemics right now. Because it's one thing for it to come and then you find some other ways, or you use social distancing, etc., to limit its impact. But it's also another to just have good preparedness so that if it comes, you are able to deal with the aftermath of that pandemic. I think now part of the discussions around COVID are to talk about how can we prepare better. So this conversation then and the COVID has heightened the agency for public policy intervention. As we have seen, many countries have engaged in trying to either limit the impacts of the COVID or maybe even try to prevent any subsequent spread of the COVID. And COVID-19 pandemic has spread worldwide and affected individuals, communities, and national as well as global economies. But effective and efficient responses to this pandemic would require resources to be directed towards the vulnerable areas of society. Because at any point in time, no country has every resource that is needed in order to reduce the impacts of the pandemic. And therefore, targeting issues are critical. But in order for us to do good targeting, we need to know which areas need intervention the most. And therefore, to be effective as well as efficient, responses need to be informed by evidence, by data, by science. And this is an attempt ourselves to contribute to that, as we're going to learn. Now, we also say the impacts of these crises, as you would imagine, are especially severe in areas where chronic vulnerability is already high. So if you think of any country, there will be places where the impacts are not likely going to be severe because of other inherent factors in that area. Okay, so it is very important at least to understand with those areas with chronic vulnerability in order for us to, for governments to know what to do and where. Therefore, understanding the patterns of vulnerability is of major importance to guide strategies to prepare for and respond to those crises. So if another crisis of a similar nature was to come later, it would be very useful and maybe it would even reduce the deaths among people, if we were able to know where the impacts will be severe or more severe than others, because then governments would have to target those areas quickly in order to limit any negative impacts of that. So at academia, and through also this kind of research, our goal is to identify those areas that if they are affected by COVID, they would have at least, or they would have the least capacity to absorb the shocks and would face the most serious consequences. Because if we do that, then we can target those, or governments can target those, or development partners or civil society or whoever has resources would probably target those areas so that they can, then we can limit the negative impacts. So we're talking of vulnerability here. The way we have defined vulnerability for purposes of this work is that vulnerability is the propensity of an area to be exposed to the spread of COVID-19, combined with limited capacity to control the spread of the pandemic and limited capacity of care to care for the infected people, as well as a high exposure to negative food security impacts. So in other words, our definition of vulnerability is talking about a combination of a number of factors that we think if they exist at the same time at a particular place, they can together shape whether or the extent to which that area is going to be vulnerable to the effects of the pandemic. So here it's also important to differentiate things. We are not trying to map where COVID is likely going to go and spread. No, that's not what we're doing. But we're saying if COVID were to spread in a particular province, how prone would that province be? Or how prone would that area be to the effects of that spread? Okay, rather than trying to predict where COVID is going to be. That's a totally different question. So again, without overemphasizing, we say due to limited resources, prioritizing the most vulnerable communities where the effects of the pandemic are likely to be proportionately more devastating is useful. And therefore, the research that we're embarking on within academia, similar to this one, is very useful. And vulnerability by its nature is not just uniform across any place. It varies from one place to another for the sole reason that the variables that constitute vulnerability are also going to be changing from one place to the other, and their combination is also going to change from one area to the other. This study is focusing on the differential spatial vulnerability using a kind of a combination of indicators, and those indicators, they fall in several categories. The first part is to do with food and nutritional security, because I think studies have already shown that societies or communities that have good access to nutritious food are going to have people who are healthier, and those people who are healthier are likely going to at least give some resistance or to withstand the negative impacts of COVID. So it's good to have food and nutritional security as part of the variables which constitute vulnerability, the overall vulnerability indicator that we're constructing. And again, disease burden, so the incidence of other diseases in the community is a useful indicator that we have to take into account. And again, health infrastructure and outcomes, I think this is obvious to comprehend, because if you do not have health infrastructure, you can, even if you're very healthy already as a community, if a pandemic were to come, you would suffer more than if there were health infrastructure within there. If there were, for example, doctors, nurses, etc., or health facilities like hospitals. And again, population density. Population density obviously is useful because even if a place were to have a lot of doctors, but if it was densely populated, it would make the pandemic easy to spread, but it would also impose a lot of pressure on the health facilities that are there. And with the result, it would be a negative impact. So the outcomes would be more severe than elsewhere where the density is not as high, all factors being equal. All right, so now given that background in terms of the indicators that we have, as well as the goal of this research, that is to construct indices of vulnerability and try to map it across the country in order to identify which places are more at risk of negative effects. Now let's talk about a bit of the methodology. So we are studying this question with respect to Mozambique. So Mozambique, it's a vast country. Most of you know it. It spans almost like thousands of kilometers in terms of the coastline. It's a very long country. And it has about 10 provinces. In this case, 11 areas that we want to study. So these provinces include Cabo Delgado here. We also have Gaza. We have Ihambani. We have Manica. We have Maputo, which is the capital, the province which hosts the capital, Nampula, Niassa province, Sofala, Tete, Zambezia, as well as Maputo city down here. So there's Maputo province, but also Maputo city. Okay. Now, these provinces, obviously, they have, there are variations in terms of, or with respect to the indicators that we're talking about. So the indicators in terms of how much coverage in health infrastructure, the incidence of diseases, the prevalence of malnutrition, etc. There is variation across this country. And it's that variation now that we would like to exploit in order to compose indices that now we map and draw conclusions from. The data that we use for this study for Mozambique, the data are kind of extracted from the demographic health surveys, as well as the Mozambique national census data. And the indicators that we're using, which are also the sub-indicators that we combine together using a methodology we're going to discuss into a composite index of overall vulnerability in Mozambique, include the height for age. So the height for age is just it's another, in other words, it's stunting, it's trying to measure stunting. So this is the percent of children with height for age of more than 2 standard deviations below the World Health Organization median. And this is also the same with weight for age, the prevalence of underweight, and weight for height, which is the prevalence of wasting. And then we have, so these three are proxy nutrition, the status of nutrition and food security in the country. And then we also have others to do with disease burden. So for example, diabetes, the prevalence of diabetes as a percent. So this is just a percent of women with diabetes in the population, I think as found in the demographic health survey. And then we also have the prevalence of high blood pressure. So percentage of women with the who reported that they had high blood pressure, as well as now on the other. So these two, we can think of them as proxying the disease burden, the diseases, the status of the community in terms of being prone to diseases. Because from theory, we also know that where people, or a lot of people have or suffer from these non-communicable diseases like diabetes and blood pressure, they also tend to be more prone to other ailments that come. Okay. And then the other set of indicators are the proportion of females getting assistance from a medical doctor, a proportion of women who get assistance from a doctor during child birth. This data is also available in the demographic health survey for 2017 for Mozambique. And then the proportion of females for whom distance was reported as a big challenge for accessing health services. Okay, so together, these are also summarizing the status of health access in the country, where, for example, the proportion of women complaining about distance is a lot, then we know that there is a problem with that. So those communities are likely going to be not good, they're not likely going to be prone to a problem if it rose. As well as the same can be said about, or the opposite can be said about proportion of females getting assistance. So this one, the higher the number, the good it is. So places where there's no, where a lot of women receive assistance from doctors during childbirth, we know that at least those areas are well equipped as far as medical assistance is concerned. So those are likely not to be very prone to the disease if it were to fall, because then doctors would be there to help. So at least it's a proxy of the status of the health system. And then we have food expenditure per capita. So this is just food expenditure, and we're looking at the higher it is per capita in a community, the better, because then people have spending power. You don't spend what you don't have. So this is not about the share of spending in total budget, no, because then the meaning would be different. But this is about how much you spend. So the higher we know you spend on something, at least it can proxy that you are okay, you are getting good access to food. Then the last one that we consider for constructing this index is the density of the areas that we study, the population density. So how many people per square kilometer in the, are residing in that area? It is an important indicator also because, again, the higher it is, the more likely that health facilities are going to be under pressure if a pandemic was to come. And therefore, that's where it is high. We know it is an area where you have to pay attention to with respect to that if you are to minimize the impact of a pandemic that was to come. Now, equipped with this information for the sub-indicators, the next step that we followed was to construct an indicator to measure the level of vulnerability to serious food security consequences of COVID-19. And this has three components. We're looking at susceptibility to the spread of the disease, inability to care for the infected people, and existing food and malnutrition and nutritionist insecurity. So if you think about these three, really, they're talking about the same stuff I was talking about the infrastructure coverage, about the prior disease burden or existence of comorbidities, the issues of stunting, underweight, and wasting, all those also are coming to this, and as well as the issues of population density. They can also be thought of as falling within these three categories here. Then we identify areas of particular concern where governments should focus crisis monitoring and mitigation efforts. Because I think we can agree that they, like I said at first, once the pandemic comes, you have now to fight in order to stop its spread. But in that fight, you need to be able to know where the impact is likely going to be severe, the negative impact. So this kind of work is helpful. But you can also try to be just prepared before the pandemic comes. You know already that that certain areas are equipped with certain things and some areas are less equipped with certain things or certain facilities. Then you address those by deliberate policies. Then you make them even more resilient to any future pandemic that can come. This way it can also be used that way. In any case, it is useful for trying to minimize the impact of COVID if the recommendations can be used. In terms of the methodology, I'm not going to spend much time here, but in terms of the methodology, we separate between two types of variables. So there are some variables whereby the more they are, the better. We want them to be more. So for example, if you have health number of people who are helped by a number of women who claim or report to have been assisted by medical doctors at the hospitals when they were giving birth, the more we have of that, the better. The more we have of income, the better. So we have those indicators. For these indicators, then we know that more is better, and the way we have computed them is just as below. So just as an example, if you find that in an area, the observation there, or the observation for that specific indicator is greater than the average for the observation, plus 0.67 times the standard deviation, then for that indicator, which is a good indicator, I mean, the more the better, then we know that if it satisfies this condition, then it's much less, that we can categorize that place as much less vulnerable. And again, if the indicator is greater than the average, but is less than the average plus the standard deviation, or times 0.67, then we know that, okay, that value is large, not the largest, but it's large enough to an extent that we can say the area is less vulnerable, and we give it a category of 1. And then if on the other hand, that indicator is greater than or equal to the average minus the standard deviation, but it's less than the average, then we know that it's more vulnerable. So we give it 2, but it's not the most vulnerable. However, if that indicator is less than the average minus the standard deviation, then it means it's really very small, that observation, and therefore we give it a 3. It is much more vulnerable. That's the first part, or the first category of these indicators. But there's other indicators are bad indicators, not bad, but at least they are measuring bad. So for example, diabetes prevalence. The higher the number you get, the higher the proportion, I mean, of that indicator, the higher the proportion, it means that's bad news. So the categorization of that is different, because now more is not better, but more is worse. E.g., diabetes, malnourishment, malnutrition, blood pressure, as well as distance to go to a health facility. So for those ones, if, for example, an indicator is less than the average, and if it is less than an average minus the standard deviation times 0.65, then we know it's very low. So because it's very low, and this is a bad indicator, but in quotes, then it means the lower the good, so it is much less vulnerable. Again, we categorize it to be less vulnerable using this inequality here, and more vulnerable using this inequality here. And in fact, if the observation for that indicator is more than the average plus 0.67 times standard deviation, then it means that's too much. For that bad indicator, we should categorize that area as much more vulnerable. So we use this thinking then to program this in in order to produce the categories from the data, and then we use the data now to put it on the map. Otherwise, in terms of the overall vulnerability indicator, it is just computed by K minus the sum of the weights here, where K is represents the number of indicators that you are considering, and the WLIJK is the weight associated with the ranks, the 0, 1, 2, 3 that I've just talked about there. Okay, once you have done that, then we now submitted we utilized the categories into, we prepare them for purposes of constructing maps. And once we do that, then, well, here are the maps. So this map here is talking about now the overall vulnerability index. So what we're going to present here is the maps for each sub-indicator, which constitute the overall index of vulnerability. But most importantly, at first, I'm going to present the composite vulnerability indicator. So you combine all the other indicators and see which areas are more vulnerable or less vulnerable or more prone to any kind of a disease, for which the indicators that are in that vulnerability index are important in the determination. Okay, so here, this is the overall vulnerability index. If you look at this, you'll find that Zambezia province, Nampula province, Cabo Delgado, Niassa, Tete, these are either yellow or, red or amber. It's amber. Okay, now here. Yeah, so now, but these ones then, in terms of the interpretation, we see that these are much more vulnerable or much vulnerable. But on the other hand, Manica, Sofara, and Ihambani, they appear to fall in the middle. Not so, they're just less vulnerable. Less vulnerable. But then if you go to Gaza, Maputo City, these appear to be much less vulnerable. So remember, the reason we're doing this is because we want to know, we're not trying to explain in terms of the causal reasons as to why a place is, is likely going to suffer too much, or why a place has those characteristics. But we are saying, given this composite, this data and the composite indicator, this is what is the situation in Mozambique. These are areas which are likely going to be more prone to COVID or any other similar ailment if it was to spread there, because of different reasons, which are going to be explained as we go below from one sub-indicator to another. And again, Tete, Niassa, and Cabo Delgado also follow as second, and third are Ihambani. But Gaza, Maputo, and Maputo City, they seem to be okay. Now, someone would want to think, but in Maputo, we know that there was also a lot of COVID cases. Remember, we're not saying that our index is going to predict where a COVID case is going to be, but we're saying whatever impact you see in that particular province at that particular time, if you knew a priori that it is going to come, and if you already knew the other characteristics, then maybe you would have been more prepared to minimize the impact of that. Okay, so it has nothing to do with prediction of where COVID is going to fall. Now we start going into the sub-indicators, and we start with the nutritional food security indicators. So stunting is the one among the three that I think it's very useful, because stunting also talks about the long-term impacts of food insecurity in a particular place. If you map this one, you see that in Nampula and in Zambezia, these two, it seems it's worse. There's a high proportion there of children who are stunted. The second one to be west of is Tete, and then the others come. Okay, so the ones that appear to be not so affected are Gaza and Ihambani. Now, to be frank, like I said again, and I need to repeat, why such is the case, it's not a part of the study, because we did not go and say, why is it that stunting in Ihambani is so high, so low compared to Zambezia? That we did not, it was not part of this study. But I think it would be useful to just also understand in separate pieces of research. But we say, given the status quo, this is what it is. As far as stunting is concerned, this is how it maps across the country. Nampula, Zambezia, and then Tete, these are worse off. And then Gaza, Ihambani, they seem to be to have less of that problem. Now, the implication of this is that in Zambezia, as well as in Nampula and Tete, stunting contributes significant contributes the highest to the overall vulnerability indicator. Okay, so and as you can see already, of course, if you go up there, it's also Nampula and Zambezia and Tete. They are part of the provinces which are west of there in terms of overall vulnerability index. And again, if you go to underweight, it's the same story basically. Okay, it's Nampula, Zambezia, and Nampula, Zambezia as well as Tete, and it's like the same pattern is repeated with respect to this nutritional indicator again. And we also have the same with respect to wasting. So the implication, again, for purposes of talking about overall vulnerability of these places, is that these food security indicators, or these nutritional indicators, are weighing heavily, or they're contributing a lot to the variation in the overall, or in the constitution of the overall community level vulnerability to the effects of COVID-19. Okay. And again, here you see that Gaza, Ihambane, Maputo City, they seem to be much less vulnerable with respect to this wasting, as well as with respect to underweight and with respect to stunting. In other words, stunting, wasting, as well as underweight contribute less to the overall community level vulnerability index that captures the effects of COVID-19 as constructed in this, okay, for these particular cities or provinces. Then we come to the consumption spending per capita. When you come here, you also find that, interestingly, of course, the whole country appears to have a big problem, which I think makes sense. Mozambique is still a poor country alongside its sister neighbors there, Malawi, etc., where the incomes per capita are still less than the minimum threshold for it to be considered a middle income country. But we see that once you use this indicator or sub-indicator, then Zambezia and Nampula are also very worse off. Then Tete is second, together with Niassa, Cabo Delgado, and almost everywhere else, the only exception being Maputo City, which is much less vulnerable. And I think Maputo City and Maputo province, because these are in relative terms, we know that although the country is poor, but relatively, if there are any rich people, some of them, a lot of them, I think they should be living in those in the capital. Okay. Then, again, in terms of the interpretation, it means that this, at least in Zambezia and in Nampula, the consumption per capita, consumption spending per capita contributes a lot or the most to the overall community level vulnerability to COVID. So these areas would be considered much more vulnerable, but with respect to consumption per capita. Remember, when we talk about the overall vulnerability to COVID-19 effects, we're not just talking about these partial ones, we're talking about the everything combined. But each of the indicators contributes something to that overall vulnerability. You can think about it as, say, variables in a regression model whereby each of them has a partial effect towards the overall result. The next set of sub-indicators that we consider are the access to health services and vulnerability. Again, as I said, access to health services is an important indicator, basically. So any indicator within that realm is important, because if you're ill, you have to go to a health facility in order for you to recover. You have to meet a medical doctor once you have gone into that health facility in order for you to recover. And we also know now that the more the health systems are prepared, or the more equipped they are, the less likely people are to die of this pandemic. I think I saw somewhere in the newspaper where they're saying Africa is now a continent where you're more likely to die if you were to suffer from COVID, I mean, if you were to suffer from COVID but severe and you go to a hospital, then you are likely going to die compared to others. It's because of poor access to health facilities. So it is an important indicator. And if you take a look at the two indicators to proxy this health services access, you remember we had the proportion of women receiving assistance from a doctor during childbirth. If you look at these ones, then you will see that Zambezia has a problem. Cabo Delgado is more vulnerable, much more vulnerable again, and then followed by Inhambane, Tete, Nyasa, and Nampula. So in these places, these are places where if you are, I mean, if a woman goes to a hospital, they are less likely to be helped by a medical professional, by a health professional during childbirth. So that is just telling us something about the adequacy of health facilities there. And therefore, in as far as the overall vulnerability to the effects of COVID-19 are concerned, these are also the areas where the access to health contributes significantly to that vulnerability, overall vulnerability. Okay, so if there was something to be done as far as these areas are concerned, but with respect to trying to health to staffing of health facilities, these are areas which would have to be targeted as well. What is of interest is that the other indicator as well, which is the number of the proportion of women who complained about distance as being a problem to go to a health facility. If you map that, it almost mimics the one for number of or proportion of women who were assisted by health professionals. So meaning that indeed it's also a good proxy for, at least it's a similar proxy of similar power for the health service access here. And again, Zambezia, Cabo Delgado, Inhambane, Tete, Nyasa, as well as Nampula, they have a problem. They are ones that appear to be extremely vulnerable in as far as this is concerned. They are more prone to this problem. If you're there, you are more prone to complain about distance to a health facility. And therefore, distance to health facility also contributes significantly to the overall vulnerability indicator in these areas. Equally important to note is that Maputo, as province, as well as Maputo city, for both indicators, also they seem to have less of a problem. They are categorized as much less vulnerable. So if you're there, relative to any other, if you are in any other place there, you'd have much more better access to health facilities if you were to go to the hospital. So in those areas, then the contribution of these health sub-indicators to the definition of overall community level of vulnerability is kind of low there. Okay, after that, then we look at the disease burden indicators. As I said at the opening, let's start from an individual. If an individual has comorbidities, they already suffer from other underlying conditions, for example, diabetes, hypertension, blood pressure, etc. They are likely going to be prone to new diseases that can come, because diseases obviously take advantage of. We have billions and billions of disease-causing organisms in our bodies every time we're moving, we're walking. But whether you become now sick from their presence depends on the weakness of your body. So if it appears that when you have these comorbidities like diabetes, as well as blood pressure, as an individual, you are going to be susceptible to new diseases. So especially COVID-19, I think science has already also shown that that is the case. and even you agree with me that vaccination programs for many countries, whether in the West or here in Africa, they're using these comorbidities as an indicator that they should prioritize a person or not. So age, as well as the incidence of these confounding or comorbidities. So at the community level now, it means if a community has a lot of people who have those ailments already, those communities are likely to be more prone to a problem if it were to come in that area compared to the other places. So in those areas with a lot of these pre-existing health problems, then health problems or disease burden contribute a lot to the overall community level vulnerability to the effects of COVID-19. Now, when you map that with respect to women who have blood pressure, then you see that, interestingly, Gaza, Ihambane, Maputo City, these seem to be much less vulnerable with respect to that. But Nampula and Zambezia and Tete, which were also had a problem with respect to food security, and nutrition, they also seem to be the ones that are worst hit. So Nampula and Zambezia have high proportion of women with blood pressure problems. So in those areas, blood pressure problems contribute significantly to the overall community level vulnerability. So the partial effect, at least if you just hold everything constant and you just take a look at Nampula and the Zambezia and Tete, you wouldn't be wrong to say that you would expect that these areas would have would be more likely to be prone to the negative effects of COVID-19 if it was to come there, just on the basis of that indicator alone. We know that at the end, the overall effect depends on a combination of those all indicators, but the partial effect would be that. So there's a great contribution of this indicator to the overall community level vulnerability in Nampula as well as in Zambezia and Tete. If you look at the proportion of women with diabetes, you also find that Zambezia, Nampula, and Tete they lead the way, seconded by the Nyasa, Cape Delgado, Manica, and Sofala. But this time, we also find that Maputo City and the Maputo province, they come kind of third, and the ones where there's much less, who are the provinces which are much less vulnerable, are Gaza and the Ihambane. So if you're a policymaker, then at least given this, you would be able to know that if you wanted to act or to equip communities, but with respect to, say, trying to reduce the diabetes, trying to reduce blood pressure. So these are provinces you would need to try and target first. Not that you shouldn't do anything in the other places, but we're saying there's a huge problem in those other areas. And as a result, those problems contribute a lot to the overall level of vulnerability to COVID-19 in these areas. The last indicator that we considered is population density. Again, the theory behind this is simple. If an area is so dense with people, it has a lot of people per square kilometer, even if it had a hospital, if a pandemic was to come there and hit, it would lead to a lot of pressure, okay? It would lead to a lot of pressure for the health facilities, and that would be a problem in terms of health access. But another thing is that just the sheer effect of having a lot of people in a particular area is going to predispose that community to problems or to the quick spread of the disease, because there's nowhere to hide. If you go everywhere, in any place you go, you're likely going to meet other people who are you are going to transmit it to them, or they're going to share it with you. So population density is an important indicator. In this, it contributes to overall community level vulnerability to the effects of COVID-19. And if you map it, you see that Nampula is a big problem. It seems to be very dense there, as well as Maputo province and the Maputo city. And then the second one is Zambezia, and the other ones, Tete, come second. Okay, come third. Okay. So that also means that for the city, or the cities of Maputo, as well as for Nampula, these are areas where population density contributes significantly to overall community level vulnerability to the effects of COVID-19. And again, it's vulnerability to the effects of COVID-19 rather than vulnerability to COVID only, because we're not saying that it's vulnerability to, or it's the likelihood that you are going to catch COVID. It's not like that. Okay, so these are the results that we see, we get once we follow the methodology and map the data. And we have some conclusions. So the first conclusions that they deal with we're just saying the vulnerability indices revealed widespread inequalities across the 10 provinces and across the Maputo provinces that we have analyzed, meaning that we're seeing that not every place is as vulnerable as the other. Others are more vulnerable than others, but for different reasons. But in general, Nampula, Zambezia, Tete, Niassa, and Cabo Delgado provinces are the most vulnerable to the COVID-19 pandemic and its outcomes, or the effects of the COVID-19 pandemic. Okay, if the pandemic were to spread in those areas, you would likely find it that you would have more problems than you would anticipate. And secondly, these provinces need, therefore, to be prioritized in the design of intervention efforts to prevent and mitigate the effects of the pandemic in future crises. So it doesn't just have to be COVID-19. These findings would also apply if we are talking about the spread of, say, something like the SARS, or maybe, okay, I'm just example, maybe, for example, Ebola, but we're not saying it should be there, but this is just as an example. If those diseases that are human transmittable were to come there, and they're transmitted through air, droplets, etc., yeah, then those provinces would have to be, we would need to prioritize, they would be more prone to those kind of negative effects. So we would need to prioritize interventions in those areas to reduce the likelihood of serious negative consequences. So this message, if it can go to both, obviously, the Mozambique as a government, as well as the development partners, the private sector, civil society institutions, if they can have this information, then it would probably also be useful for them to start targeting or programming their interventions in such a way that they address some of the specific issues for those areas. So we know where diabetes is likely a serious problem. We know where food security problems are a big problem. We also know where the consumption of food is a problem. We know where population densities are a problem. Any efforts to improve those can be targeted to where we have mapped. So that's one contribution of this study, to be able to reveal what problem is. There is need to reduce inequalities in the longer term in terms of infrastructure. So there are other places which are well endowed with health infrastructure. Granted, health infrastructure in Mozambique is not as robust as anywhere else, but even that little that is there is skewed towards other provinces, and there is less in other areas. So it would be good to start reducing that inequality by having programs where you now build new health facilities in those other areas rather than just to congest them in a few locations. Preparation for future pandemics and other health shocks that are inevitable should take these spatial vulnerability differences into account. I think we have already been trying to emphasize on this from the onset of the presentation. And we have to implement policies that reduce vulnerability to such shocks. So these policies would need to be isolated from those sub-indicators of, say, nutrition, those sub-indicators to do with disease burden, as well as those nutrition to do, those indicators to do with general economic empowerment of the population. With that, I say thank you very much, Monsieur Moderator, and over to you.
Okay, so thank you very much, Greenwell, for a very clear presentation with a lot of good information that can be applied and used by policymakers as they grapple with this pandemic now and also as they prepare into the future. So thank you very much. So now, ladies and gentlemen, we enter into the plenary session where we will have time to discuss, post questions, make comments. I encourage us to use the chat to do that, but also for anyone who would want to ask a question, you are free to raise your hand. I will see it and I invite you to either ask a question or make a comment or contribution. But to get started, allow me as your moderator today to maybe begin this discussion by asking Greenwell and his team. So the work that you have done analysis at the provincial level, the 10 provinces plus Maputo City, as you told us. So one would ask, is there a possibility of doing this analysis at a lower level, say at district level? Because probably then there might be more variation and the policymakers may be able to use that information to even target better. So you can respond to that, but also in addition to that, I think from literature, we know that Zambezi and Nampula provinces have high agricultural production potential, but from the results that you presented, indicators related to nutrition like stunting and wasting, that seems to be a problem. Can you provide some insights into that and what maybe the policymakers need to do? So we can start with those, but meanwhile, kindly use the chat, lift your hand up, we'll see it, and we will invite you to ask question and make contribution. Over to you, Greenwell.
Thanks very much, Paul, for the enlightening questions. So let me start with the one on the level of analysis. I think that is a very valid question because we know that vulnerability, just like we're looking for looking to understand vulnerability across the provinces, it would also have been very good to understand the overall community level of vulnerability, even across households, as well as across districts, as well as across maybe other smaller disaggregations within Mozambique. What we noted, though, is that a key challenge is to do with the availability of data. It is not so easy to find data for, say, blood pressure or this malnourishment and population density, but are disaggregated at a very smaller units. For example, at say district level. It's not, data for that is not there. I mean, we don't have data for that. And so really the choice of the provinces was mostly motivated by the absence of sufficient information at a smaller, at the microcosm of society. If it was, say, possible to get it at a very lower level, we would also be very happy to do analysis at that very disaggregated level, because we know that we would even come up with other very interesting intra-provincial variation, but that information is not there. So maybe one of the key issues there for the Mozambican government going forward, it would be, and as well as many other countries, I think we would always, it will always be good to strengthen data collection systems, strengthen those systems in such a way that we can have data at very smaller sections of society. So maybe at a district level, at the very least, it would be very useful if we had that. Even for decision making, it can also be extremely useful, because we know that within provinces there could be other variations there, and capturing them requires data. So if we can have data at those levels, it can be even more useful than how useful this work is now. Your second question was to do with the high prevalence of malnourished, like nutritional, the poor performance with respect to nutritional indicators, say for example stunting, etc., in Nampula and Zambezia. And I also note that with Tete, because Tete is also a very a country, I mean a province with great potential for agricultural production. I don't think there is a clear answer for that, but one would speculate that maybe this is also a point at which we should now start thinking about, not just, so it's one thing to have to be a place with agricultural potential, but it is also very useful to start thinking about what is it that a province or a district is producing. We have seen in literature in some places whereby you find that a region that is so rich in agriculture, people are actually malnourished simply because the fact that they are rich in agriculture does not take into account the fact that they also may be concentrating, say, for example, on just carbohydrates. Maybe they're doing less of legumes, or maybe even if they farm legumes, culturally, they're not thinking that it's important to be eating them a lot. They're using them for some other things. So I think the best I can do here is that this brings us to the issue of nutrition sensitive agriculture. We need to be even thinking about the transforming agriculture in such a way that it's nutrition sensitive. If you get what I'm trying to talk about here. So it's one thing to have agricultural potential, but it's another to be, or to have information about what is it really that you need to be feeding your people in order for them to be fine, nutritionally speaking. I think that's what I would want to say. But your observation is really 100% correct. Over to you.
Yeah, thank you very much, Greenwell, for that response. And therefore, I would probably also encourage that among the recommendations, you probably include that observation that this analysis was done at the provincial level because of absence of data at district or more disaggregated level. And therefore, it can also be a message for policymakers that to be more effective in targeting, you need data at even a lower level, and therefore they should consider collecting and curating data at that level. So
100%, yeah.
Exactly. Thank you very much. So check if there are questions on the chat, or there are people who have raised their hands, because I seem not to see. Please let me know.
Yes.
Otherwise, yes, please.
Our first question from Mr. Wanwa Sentefera. Do you want me to read the question, or how do you want to deal with it?
Let me check.
Okay.
Let me check. Is it written in the chat?
Yes, in the chat. It is addressed to the panelists. You should see it above.
Oh, okay. Okay, let's see. I don't think I can see. Okay, thanks.
Can I?
Yes, Wondersen, go ahead.
Oh, yeah, please go ahead, Wondersen.
Thank you, Paul. Thank you, Greenwell, for this very interesting, informative presentation. My question is, for example, if we have, or do you have data or information on the actual COVID spread and is by province in Mozambique, to see to what extent the vulnerability assessment result that you've made corresponds or explains the real severity of the pandemic by province? I just want to check, or can we compare the severity, the actual severity, and the findings, and say something about this vulnerability assessment? Thank you.
Okay, thank you very much, Wondersen. Your question is noted. Is there another, so that he can pick a few?
No, this is the only question I have.
Okay, I'm checking with the other participants if anyone has a question. Okay, why don't you go ahead, Greenwell, and respond to the question by Wondersen.
Okay, so thanks very much, Wondersen. I think that's very, that's a very important question. Unfortunately, at our disposal, we do not have data on the incidence of the COVID-19. So we don't have data on cases, but I think you're pointing to something that would also be very interesting going forward. We probably would need to also see how we need to collect data or get data on the cases of COVID-19 in the other provinces, and try to now study more about what happened to those cases. I mean, what are the death rates there, or what were the other issues that took place there, in order to add to the narrative. And I think it would be very useful, even in terms of trying to add value to this kind of vulnerability assessment work that we're doing, not just in Mozambique, but I think across the board.
Thanks.
Over to you.
Julie, go ahead. Julie wants to respond to Wondersen's question.
Yes, please, Julie, go ahead, please.
Hi, thanks, Greenwell. Thanks, Paul, and thanks, Wondersen, for the question. This is Julie Collins from Academia 2063, and I'm doing similar work to the work that Greenwell presented for some other countries in Africa. And that's an excellent question. I think that we all should be aiming to find a way to apply the predictions that we're making, basically, with what is actually happening with COVID. However, I think we need to think about what is the outcome that our analysis is informing, because it's not necessarily the spread of COVID or even death rates from COVID, because remember, as Greenwell mentioned at the beginning, we're not so much trying to predict the spread of COVID as trying to predict the areas where, if COVID affects this area, the consequences, and in particular, the food security effects, will be the most severe. So I think what we probably would want to ideally look for is information on, people's standards of livings or changes in nutrition before and after COVID. And clearly this kind of data will take some time to become available. We can probably do some looking at organizations that there are some organizations like World Bank, LSMS has had phone surveys during COVID in some selected countries. So we could try to take a look and see if we can see coping strategies or self-reported food security impacts by subnational area. But I'm thinking that's the kind of outcome data that we would want to be looking at rather than COVID case data, since we're not necessarily predicting, or I think we're not predicting the spread of COVID. We're more predicting the food security impacts of COVID. And just to note also that I think subnational COVID data is becoming more available than it was even a few months ago. I was just looking a little bit and found that the World Health Organization Mozambique does have some subnational COVID data. So we can look into that and just see what it looks like. But I think that we wouldn't necessarily expect to see a correlation between the vulnerability index and the actual COVID case numbers, since I think what we are predicting is more likely to be the food security impacts of COVID. So thanks. Back to you, Greenwell and Paul.
Thank you very much, Julie. Yeah, I think that's definitely the standpoint. That explanation is very good, and we are not trying to predict the cases of COVID, and also in terms of it would be very useful to think about the way to measure the impact. I mean, or even if you want to validate the index using other ways, it does not necessarily have to be dates from COVID, by the way, but I think the food security impacts would be more meaningful. Okay, over to you, Paul.
Okay, thanks, Greenwell. And just to notify the participants that a link to the vulnerability hotspot work that Academia 2063 is doing has been posted on the chat. And therefore, at your time, you can click and see what other work has been done in other countries and regions. So, Sheikh, let me know whether there is a question or there is a hand up. But in the meantime, why don't I use this opportunity to also ask Greenwell? I think recently there has been a reported case of instability in one of the provinces in northern Mozambique, I think Cabo Delgado, due to, I think, incidences of terrorism. And maybe just to have to get your thoughts on how that may have affected or whether it has a bearing on the vulnerability to COVID-19 that you've been analyzing. What are your thoughts?
Thank you very much, Paul. Yeah, again, I think it's not as easy to look at the causal mechanisms there, but at least one thing we would be able to say is, so because I think Cabo Delgado right now is experiencing, and for a long time, it's experiencing issues of terrorism. As an individual myself, if I was, say, a health professional, maybe I would be less inclined to work in such kind of unstable environment because either I'm afraid or something. So I would expect that because of those disincentives for health professionals, you are likely going to find fewer of those ones there. As a result, the contribution of these indicators of access to health professionals with the overall vulnerability is likely going to be amplified. So you're likely going to see that, yeah, the effect on the vulnerability will be kind of higher. So the war is likely, or the strife there is likely going to lead to making it more susceptible to the effects of COVID-19. Because even if it's agriculture, it's not likely going to take place in a consistent fashion. Whether it's hospitals, hospitals might be built and then they'll get destroyed at some point because of the of the same terrorist activities. So I think on the whole, that instability is likely going to lead to a negative impact on the vulnerability index. So negative meaning that it is going to increase of vulnerability. So from a standpoint of policy, obviously, any attempt to stop that violence, wherever it comes from, it would be useful and it would be very good for recovery from the COVID-19 impact. Over to you.
Okay, thank you very much, Greenwell, for that response. I think I see a hand. Who says it?
It's Mr. Anatol Gunda.
Okay, Anatol, go on.
Thank you, Paul. Thank you, Greenwell. I'm Anatol Gundan from Academia. Thank you, Greenwell, for your work. I assume that you face some data limitation for this work. So I would like to know if we have the mean or perhaps in prediction for next crisis, what will be the needs of data collection? What will be the need of indicator that will better fit the interest of such study? Thank you.
Okay. Yeah, so as I said, data challenges a lot here. They have determined the level of analysis. So instead of analyzing at the district level, we've decided to analyze at the provincial level, which is still informative, but maybe it would have been more informative if it was at the district level. So the first recommendation I would have is that we need to, so maybe is talking about even ourselves. If there is a chance working with the Mozambique government, we need to intensify the work on e-atlases, because you remember we launched the e-atlas in Mozambique, and we constituted a team of e-atlas experts there. If we can work with them and try to mobilize some, get some data from provinces working with the government, assuming availability of funds, that would be useful, because then we can try to gather some of this information at the district level, or at least some other subnational level that is more disaggregated than the provincial level. But also, we need to encourage the government as a matter of policy to tend to look for organized data collection at even disaggregated level, rather than maybe just at the overall or provincial and national level, because the provinces are in key, definitely, but I think if we can even go to lower levels, it would be much better. So it would be useful to in terms of data collection effort, to look at those kind of those levels. Sorry, I think I got cut. Yeah, but in terms of data collection efforts, we would need to encourage efforts at the government level to disaggregate their data as much as possible, as well as for ourselves. If we can find resources, we need to try and work with the Mozambique government and collect some of this data for many of these indicators, but at the disaggregate level. So that's what I can think about now, taking advantage of the programs that we already have, the e-atlas and some other CADEP M&E work that we already do. But in case anybody within us has any suggestions, I think it would also be great for as far as that data collection is concerned, because I think it's something that if we can help, or if we can work together with the governments ourselves, it will also be, I think it would be very useful. Over to you, Paul.
Okay. Thank you very much, Greenwell. So, Sheikh, let me know if there is a hand up or there is a question in the chat.
Paul?
Yes, please.
Yes, just to know, thank you. Yeah, thank you, Greenwell, for the answer. But my question is more about the indicators you use for your analysis. Are they the most relevant, or those are the second best we can use due to the data availability? And then, if we have money, if we have resources, what should be the direction beyond going to lower level of disaggregation? How about the indicator we may be using if we have the ability, we have the possibility to collect them? Thank you.
Oh, okay. I see. I see. I did not take note of that part of the question. No, I think most of these indicators, in my view, would stand. They are good proxies for what we're kind of doing. But it would also be maybe great, say, for example, instead of using just income, no, not income, but expenditure on food, for example, one would want to try and see how using a proportion of the population that uses, or whose food expenditure is very, food expenditure as a share of total expenditure is high. So instead of just using expenditure on food, you use the share of expenditure on food as, in total expenditure, because that has a different interpretation. A household that has a higher share of that is a household that we know that it's poor. Okay, the poor households tend to use more of their income on foodstuffs compared to other things. So if you can also have that, it would be good. But we were unable to find that kind of data in Mozambique. Maybe it's there somewhere, but we were unable to do. So if we were able to collect that information, it would be good to just see how it kind of reinforces the results, or how it brings other kind of interpretation. The other one would be to do with just age, because we know that age is important for susceptibility to diseases. So if we were able to have the age for different age, data for different age groups, I think it would also be useful to have that. And I don't rule out the fact that maybe there would be other indicators to think about, but for now I'm thinking about that age as well as the share of expenditure on the share of looking at food expenditure as a share in total expenditure at the household. Over to you, Anatole. I don't know whether I've answered your question. Okay, so Julie is reminding me about smoking, obesity, etc. So, but Julie, you can also speak about that. Please go ahead, Julie.
Sure, thanks. I was going to say that, and I know in my last comment I said that we are looking more at the food security impacts of COVID and less at predicting the spread and severity of COVID itself. But if we had more indicators on the risk factors of like severe health impacts of COVID, then we could be a little more steered toward trying to predict deaths from COVID, for example. If we had subnational data on smoking, on obesity, and on additional pre-existing health conditions. So we have two of them, high blood pressure and diabetes, but there's a lot more that we would want to look at if we had the data available. We could, if in an ideal world, if there were more survey data, we could also look at things like people's behavior in terms of masking and see, and predict in that way which areas might be more susceptible to COVID. But that, of course, is not something that's available for most areas or necessarily any areas. Thanks. Back to you, Greenwell.
Yeah, thanks very much. I think, I agree with that. So over to you, Anatole. But Anatole, if in case you have anything that you think might be useful and you can suggest, it would also be good to have it.
Thank you, Greenwell. No, not at all. Maybe I can think of where food come from for each localities. Maybe, for example, some cities may be very isolated from others. So whenever we have those kind of crises, they may be more vulnerable than others. So the origin of food they are eating or consuming can be also an important variable. Thank you.
Oh, that's interesting, because then, okay, another way then for that would be to categorize the places in terms of whether they are net producers or net importers of food.
Yes.
Okay, but I think, yeah, that's a good point. The team should, we can think about that even more later to see whether that's possible to do, and whether it would be easy to come up with such kind of data as well.
Yeah, I think
okay.
I saw some work from academia on nutrition, so we can, let's say, see nutrition, the origin of nutritious foods, what are coming from the local agriculture, what are coming for other city, what are coming from outside the country. So it may be also interesting. Thank you.
Okay, great, thanks. Over to you, Paul.
Thanks, Greenwell. Thanks, Julie. Thanks, Anatole. Julie, is that a new hand?
Oh, it is a new hand. I know that
Okay,
our
go
time
ahead.
is up. I can be extremely quick and just say that it would also be interesting to, if we had the data, look at employment shares by sector. We know from a little bit of analysis we did on firms in Democratic Republic of the Congo that firms in some sectors like hospitality are much more likely to close due to COVID restrictions than firms in other sectors. And small firms also are more likely to close and to lay off their employees. So if we had information on employment, then we would also know which areas are more likely to be affected by income losses due to COVID lockdowns. So thanks, back to you.
Okay, thank you very much, Julie. I think we are coming to the end of our time. So two maybe points before I say my final word. So first, I think for Greenwell and the team, you probably are thinking about how you're going to share this work with the policymakers in Mozambique, maybe by either sharing the brief with them or organizing maybe a national level event where you can communicate this work. I think that would be useful. But I wanted to revisit a little bit the question of how we measure food expenditure. I think, in my view, per capita expenditure might be the best, because if we try to look at the proportion of expenditure on food out of the total income, you know from economics that doesn't change very much. And in fact, if anything, the proportion of income spent on food is higher among the poor people. And of course, people don't spend too much more money on food as their income increase. So I guess my bet would be per capita expenditure, maybe per individual, could be the best way to capture that. Otherwise, I thank you very much all for attending, and also for your comments, questions that have enriched this debate. And now I would want to hand over to Sheikh to do the closing. Thank you very much.
Thank you very much, dear moderator. So I would like just to share with you an announcement, and it is the latest initiative of Academia 2063. It's a program called the Africa Agriculture Watch, AGWA. So we will launch it on June 10th. And I'm just posting the link to our newsletter. You can subscribe so that we will share with you the way forward, and you will join the launch of this program. So that's the announcement I wanted to make. And just to thank you very much for joining this webinar.